apparently that could help with our fibromyalgia, a way of dealing with our pain from fibromyalgia. Now, I have to admit, when I read things like I'm going to share with you, I to ask myself, is it real? Is it a legitimate form of treatment? Can an app actually help us? I do have my doubts about digital cognitive behavioural therapy for fibromyalgia. It's becoming recognised, and also it's going to get some insurance backing. Now, obviously, they believe in it, so maybe I should, but I'm going to find it really hard to take this in and even consider this as a legitimate form of treatment. Now, so Highmark Health is going to provide insurance coverage for Swing Therapeutics Stanza, and it's a digital therapeutic for treatment of fibromyalgia symptoms, according to an announcement from Swing. Now, behavioural therapies like Stanza are guideline-directed treatments for fibromyalgia. But until now, access has been rather limited for both patients and providers. You see, there's not many people that actually do behavioural therapies, cognitive therapies, but put it in the hands of an app. I kind of think it's a little bit harebrained, but they're willing to put their money where their mouths are, so maybe I need to pay attention to this stuff. So, the CEO of Swing, Mike Rosenbluth, says that Highmark's decision is a pivotal moment for the people living with fibromyalgia, offering them an opportunity to incorporate effective non-drug options into their care plan. Okay, sounds good. Because drugs are a flipping issue. Now, I take a variety of different drugs to deal with my fibromyalgia, and some aren't the problem, and some aren't. I just recently had my blood tests back, and it seems to cause some imbalances with my bloods. The Highmark is going to offer reimbursement for its commercial members across Pennsylvania, West Virginia, Delaware, and New York. And Stanza is a smartphone, smartphone-based self-guided digital acceptance and commitment therapy, an ACT. Even got an acronym, right? Which is a form of cognitive behavioural therapy, CBT, and is available through Swing Care, and it's a specialty clinic for comprehensive fibromyalgia treatment, which launched in Pennsylvania back in 2024, since last year. The Swing Care aims to provide patients with access to virtual care, integrating non-pharmacological therapies, no chemicals, basically, include behavioural care, sleep management, meaningful movement coaching, and peer support, with including medication management. Now, I'm not going to get into detail because it goes on and on and on, but as someone who suffers from fibromyalgia, dealing with our medication and making sure we take it at the right times. Sometimes I miss medication because I forget. Right? I do have like pill pots and stuff like that, to help me in the mornings, make sure I take what I need to take in the mornings. But in the afternoons, I kind of forget. I often forget, so maybe that could be help. But then again, there's already pill management apps out there, so I could just use one of them, I suppose. And another thing I suffer with is my own fault. Like at the moment, it's like 12:30 at night. I'm terrible at going to bed on time. I really am. And so my sleep management is rather, how to put it, non-existent. I'm terrible with it. I really am. And I could do more sleep, more regular sleep. At the moment, what I do is I don't have a huge amount of sleep at night, and I have a siesta during the day, usually. And it's also saying about movement support as well, some movement coaching, making sure you keep yourself flexible. and all of that, you know. So you can kiss the bottoms of your feet and that, you know, as you do. Well, so behavioural habits, basically, isn't it? And I've got some terrible habits. Because I don't go to bed very early, I tend to eat late at night, and I shouldn't do. And then go to bed with food in my stomach. That's a stupid thing to do. That's my own stupid fault. But that's me. I'm not saying it's an excuse, is it? Well, it does sound like I'm making excuses. So could I have an app that manages my is it going to change my habits? That's the thing, isn't it? You've got to believe in it, haven't you? It's like a lot of these things, like, for instance, smartphones and stuff like that. You know, not smartphones, I mean smartwatches and so-called managing your calorie intake and stuff like that. It's great while you actually got commitment, but it's a commitment that's easy to, just push one side and forget about it, and then you miss one day, then you miss the next day, the next day, the next day, and unless you actually round yourself back in again and carry on, from where you stepped off, where you left, you're going to carry on making the same mistakes. My best way, the way I see it, is actually to have somebody who manages you, a person. That'd be my thinking. Like, for instance, when I was on diets and stuff like that, when I had the backing of somebody, and that was my dear wife, used to help me make sure I eat the right foods and stuff like that. I was committed as well. I was going to the gym every day and stuff. It was before I had fibromyalgia, mind, or before I knew I had fibromyalgia, and it was that commitment to something. But as soon as you break the commitment, like you could do with an app quite easily, even you get reminders and stuff like that, but you just swipe it out of the way, don't you? So I've got my doubts. I really have got my doubts how useful it would be. But I suppose the proof will be in the pudding. Yeah. And we're really happy to beat the old like button. Apparently it helps the channel, Yeah, so that's my thoughts on it. I'm not convinced. I'll be absolutely honest with you. Toodaloo.